right, so I just gave a dose of sedation and neuromuscular block, so I'll hold the tube now.
All right. And we already applied the lollipop to the cheeks. You can also use an adhesive remover if there's any extra residue on the face. We're going to let that dry before putting down the Duoderm. And before removing the tube, it looks like it is at 14 at the teeth. And I'm just going to go ahead, our cuff is inflated, the patient's properly paralyzed and sedated. I'm going to go ahead and move the tube to this side of the mouth, the right side. And just make sure that it's not completely to the side, just to avoid pressure ulcers. And now the cheeks are dry, so we can apply the Duoderm. You want the Duoderm to cover most of the face. You don't want it to cover any hair. And you want to be aware of any adhesions on the cheek before applying it. Communicate that to your bedside nurse and the team if necessary. Just to ensure that the Duoderm is completely adhered to the face, you can use the warmth of your hands. And I'll begin to put the first piece down. You want to make sure that the first piece has a good amount of coverage on the cheeks. The longer and bigger the coverage, the better securement. You want to get, with the Y, you want to get as close as possible to the tube. And now I'm going to ask my nurse to adjust the tube slightly so that I can get under. So your first piece will go under the tube, and as always, you want to make sure before putting this first piece down that you are still at 14. I see that we're a little in, so I'm going to move out just a bit. And you want to get as close as possible to the tube. And then you will begin to wrap around. You will move it up, but the first wrap around, you want to ensure that it's at the base. And then you will Christmas tree it up at least twice around. Two to three times around on the first piece. And then like to make sure that this piece is long enough, because you can always cut it, but you can't always make it longer. And then you will dog ear. After putting the first piece on, I will check again to make sure that the 14 is still visible and still in the right placement. 14 at the teeth. In PICU and CVICU, we will check at the teeth or gums. In NICU, we will check on the lip. And it still looks like 14. I will cut this extra piece over here. Ensure that that is completely adhered. And then I will start on the opposite side. Get as close to the mouth as possible. Make sure that it's not on the patient's mouth if you can avoid it. On their lip. And now I will take the top piece on this side, and if you don't mind moving your hands just a little bit, I have the tube. Thank you.
Is that better?
Yes. And then I will begin to wrap this piece around. Try to make sure that you get all the way up and it's not, there's no gap on this side. And then you will dog ear this piece as well. Once you can use your hands to make sure that it's completely adhered to the tube. And then press this down with your finger. And then both look at the tube and make sure you're still at 14 at the teeth.
Yes.
Yes. All right, done taping. We can remove our hands from the tube.